When patients come to see me for a facelift and they embrace the concept of having a facelift, they often want the most minimal procedure that you can offer. And so often patients who need more will say, I just want a mini lift. And the reality is that every patient is different. So you have to assess what are the problems that are presented. So some patients have fat under their chin, some patients have muscles which need to be addressed in their neck, others have significant jowling and need to have this area filled in, perhaps with an implant or with a release of that area. And so there's a multitude of different types of facelifts, and even within a certain type of facelift, there are certain specificities of the procedure that are different. So when I look at somebody, I take a tally of what they have that's really wrong with them. Some patients are thin-skinned, have great bone structure, have no fat, a little bit of loose skin, and a mini lift is very appropriate. And that could be appropriate at age 40, 50, and even 60 if that's their case. Some patients might have had a facelift with full neck work, muscle work, fat work 10 years ago, and now they're back and all they have is a little bit of loose skin. Mini lift's perfect for that patient, and that patient may be 60 years old. But the reality is, when someone comes and they have a very full neck and they have fat both above their muscle, called the platysma, and below that muscle, and they also have significant jowling, a mini lift is going to make very, very little difference in the outcome. And we're going to have someone who may be happy at 3 months but not be happy at a year. You know, the shoe doesn't fit everybody, and that it's really important to sort of assess what the problems are and then tailor the procedure to the patient. And so we have mini lifts, we have what we call an extended subsmash facelift, which addresses neck concerns very well, and we have what's called a deep plane facelift, which I hybrid with the extended subsmash facelift. So these are all medical terms. They're really not important to patients, they're important to me, but they are the specificity that's needed to treat the individual problems that the patients present with.